Good morning, everyone. Thank you all for attending today's webinar. So my name is Jamie Lane. I'm with the Outreach and Training Unit with the Employee and Retirees Benefits Division at the Healthcare Authority. So today I have with me James Koch and Tila Wynn. They are management analysts within the Employees and Retirees Benefits Division. So I'll be passing the webinar off to them. They'll be the main presenters today. But first, I want to cover some information with you all up front. So again, thank you all for being here. Good morning, happy Wednesday. So know that every attendee has been muted. So if the system is going to allow you, please do not unmute yourself. If you have questions, please use the questions feature that's built within the software. Also know that if you're having any technical difficulties, unfortunately, we're not in a position to be able to assist with those during the webinar. But of course, you could just do the usual stuff. Try altering your computer settings, logging in, logging back out, that sort of thing if you have trouble. If you do have any trouble, though, please know that the webinar is going to be recorded and posted to the PERS website. Also, hopefully everybody received the email that I sent out this morning. It contained some information about today's presentation, along with the PDF versions of the note slides, and a link to the notices and updates section of the PERS website, where the recording of this website is going to be posted. All right, James, ready for the next slide? Thank you. All right, so in regard to questions, I already mentioned to please submit your questions through the questions feature that's built into this GoToWebinar software. And know that we'll be addressing some of those questions throughout the webinar as appropriate. But anything that's not answered during the webinar or at the end will be addressed either by phone, email, or the Fuse messaging system. Also, if you have any specific employee-related questions, scenarios, that sort of thing, we won't be able to address those questions today, but please do send a detailed message through Fuse for assistance for those. If you have any urgent matters, you can, of course, contact Outreach and Training at 1-800-700-1555. Okay, so now that that information's out of the way, I have James switch to the next slide here. Perfect. Okay, so we're going to get started on today's webinar for PEBB data for Form 1095 reporting. So thank you all, and James and Tila, I'm going to hand it off to you.
Thanks, Jamie. Well, good morning. I'm James Koch, and I'm a management analyst at the Healthcare Authority. I'm a little discombobulated because my PowerPoint and buttons weren't quickly responding. So if we have issues, we'll just deal with them as we go. My team is responsible for distributing PEBB enrollment data to employer groups, to all of you each year. We also annually produce over 162,000 Forms 1095-C, in our case, for about 150 Washington state agencies and higher education institutions. Now, I'm sure I've talked with many of you over the past 5 years about using PEBB enrollment data when preparing your Forms 1095. I recognized a lot of names on the registration. I'm really glad you could join me today, so let's jump right into it. Well, like I say, since 2015, our division, the ERB division, the Employee and Retirees Benefits Division of the Healthcare Authority, has provided PEBB enrollment data to employer groups to support their Form 1095-C or their Form 1095-B reporting requirements. This PEBB enrollment data supports two federal reporting requirements. The first is the Employer Shared Responsibility reporting requirement, and this provides IRS data about offers of coverage to full-time employees. And that's full-time under the federal definition of full-time for Employer Shared Responsibility reporting requirements. And it's reported always on a Form 1095-C. Under IRS regulations, only large employers, those with 50 or more full-time employees under the regulations, are required to file Form 1095-C. And so we have some large employers on the call today, but the vast majority of employers are small. But we'll kind of do even duty to both requirements. So check yourself if we're talking about large reporting requirements or small reporting requirements. Just make sure you're mindful of who you are. The second requirement is called reporting of health insurance coverage, and this provides IRS data about enrollment in medical coverage. And both large and small employers are directly responsible for this reporting requirement if their employees or former employees enroll in self-insured medical coverage. This self-insured enrollment is reported on either a Form 1095-C or a Form 1095-B. Now, most employers who already issue a Form 1095-C use that form for this reporting requirement. Employers who don't have to issue Form 1095-C because they don't have 50 or more full-time employees use Form 1095-B. Now, under each of these reporting requirements, both IRS and the employee or former employees each receive a copy of the Form 1095-C or 1095-B. So like I say, I noticed a lot of names and I've talked to a lot of you, but I know we have new people on the call today as well. So I want to just, as a refresher, and maybe for the benefit of the employees who are newer to this reporting requirement, I want to navigate to a few IRS resources that you'll either need for reporting or that will be very helpful. And again, I'm going to kind of refer to the small employer and large employer categories. So small employers, less than 50 employees, use a Form 1095-B. And so let's navigate to that location. So the easiest way to make sure you're getting the most current form is just to use your search engine, whatever it is, they'll all get there, and search for IRS forms. And you'll always get this within the first couple hits, but it's a forms and instructions link to the Internal Revenue Service. Let me make this a little bigger. And so if you click on that link, you'll get to a search window. And if you just type 1095, that'll get us all the hits. You can be more specific if you're looking for a B or C, but this will get us all the hits. It only returns 7 results. And you'll find here that we have the Form 1095-B, the instructions for that form, the Form 1095-C, and the instructions for that form. So again, if you click on it, you can jump right into the form itself. And these are PDF fillable forms. If you are completing these manually for your employees, actually they've changed this, so it's a fillable form. You can quickly manually create these. For smaller employers, I think it's common that you use this kind of a method. For larger employers, oftentimes you're handling much greater data, and you have maybe a utility to create these forms on your own. The instructions are very useful. The forms themselves print instructions on the reverse of the forms, but those are really intended for the form recipients. These instruction links provide wonderful information for those of us who are preparing the forms. They're very detailed, and they really go step by step with how you need to create the form. For larger employers, if you haven't seen it yet, the new 1095-Cs are out. Oh, and I would say for the smaller employers, the 1095-Bs are largely unchanged this year. There may be some little instruction changes, but the content and view of them are all the same. For the 1095-C, you'll immediately notice, if you've produced these before, that there's no Part 3 on the first page of the form. They've actually turned this form into a 2-page form for everybody, two-page double-sided. And so there are 2 pages of instructions and 2 pages of content. All of the Part 3 enrollment information now goes on that separate page. And again, the instructions down here, it's still a 18 or 19 page document, but it's the same detailed instructions. Each year, it's a good idea to review those, of course. And this training is not really intended to be a how do you fill out your Form 1095-C. It's really how you use our data to help fill out that Form 1095-C. So I don't want to mislead you that we're not a tax attorney. We're not legal. We don't provide legal advice. So you'll want to make sure that you're, reviewing your requirements on your own. But we'll point you to some of the resources that will be helpful. Okay, and then the other thing I wanted to note is for each of these, there are a couple, really helpful links that the IRS provides. And so if we go back to the IRS website, you can go anywhere as long as you're just to irs.gov. They'll have a search box up here. And if you're a small employer, I've given you in this presentation a good search phrase: information reporting by providers of minimum. I couldn't figure out how to do this quicker. Essential coverage. And if you search there, you're going to get a hit into a page that provides robust information directly from IRS about the Form 1095B reporting requirement. This is also a helpful page for large employers because that requirement is really represented in Part 3 of your 1095C. So this is a good destination to keep handy. The other search phrase I gave you is ACA Information Center for ALEs. And ALEs just means applicable large employers. And if you're an applicable large employer, that means you have 50 or more full-time employees. This page, again, provides a large amount of information for large reporters. So a couple good resources, and from here you can go off in 50 different directions from the different topics they link that are related to 1095 reporting. Okay, so let's move on. So let's talk about what PEBB enrollment data we'll be sending to employer groups. Just like in past years, we're going to send 3 different types of data in one data file. The first type of data is employee and member medical enrollment data. We'll provide data for both waived and enrolled status for enrollment in all plans, both self-insured, which are any uniform medical plan coverage, and fully insured plans. Now, small employers will simply ignore all data about employees enrolled in plans other than uniform medical plan, because UMP is self-insured coverage, and small employers only have to report self-insured enrollment in Part 4 of Form 1095B. We provide employee data about waived and enrolled status for all plans because for large employers, this data will inform your Form 1095C Part 2 offer of coverage reporting for full-time employees. Of course, employers only report UMP enrollment in Part 3 of Form 1095C because, like small employers, you only are responsible for reporting self-insured coverage. The second type of data in our data files is COBRA and leave without pay medical enrollment data for subscribers and members. Now, some of you may not have this information in your data if you don't have any employees or former employees enrolled in COBRA or leave without pay coverage. So we'll provide data for employees and former employees and their enrolled members who are enrolled in either of these types of coverage, but only for self-insured plans. So only COBRA and leave without pay data for those enrolled in UMP coverage. The third type of data is retiree and member medical enrollment data. And again, if you don't have any retirees who have, from your employer group who have elected to enroll in self-insured coverage, well, then you're not going to have any of this type of data in your file either. So we'll provide, like the others, data for the retiree and their enrolled members who are enrolled in retiree coverage, but only self-insured plans. So only data for retirees enrolled in UMP coverage. The 2020 enrollment data files will be provided on the same schedule as past years. 2020 enrollment data will be distributed in early January 2021. We always target the 10th of the month. This month, the 10th happens to be on a weekend, so we'll either get it on the 11th, on the Monday following the weekend, or we'll get it before the weekend. I say that. We may work on the weekend too and distribute it on the weekend. So, but it'll be right around the 10th of January. And 2020 enrollment data corrections will be distributed monthly thereafter. And most employers shouldn't receive data correction files. And this chart reflects our 2019 experience in data distribution. In January, you can see that we distributed 254 employer data files. In February, only 51 of those of employer groups received corrected files. In March, only 21, April only 8, and May only 2. And these totals, the declining enrollment data file count volumes, directly relate to keying within the lower limit. So, after the lower limit passes, we have far less retroactive corrections. And you might think about newborn. If an employee has a newborn in December, but they don't notify you of the newborn until January 15th, well, the newborn is eligible for December enrollment, but we would have sent you December data on January 10th, 5 days before you were notified by the employee. So in that case, you would receive a corrected file in February after the enrollment is keyed in January to account for the retroactive December enrollment. And one note, we do send enrollment data corrections for prior years as needed. For example, if we receive a dependent SSN correction, we'll send corrected data files for prior years that we sent with the incorrect SSN. So, if you see a data that relates to a prior year, it's just data that's been corrected that had a retroactive effect. So this morning, employer groups were provided all of these data files. If you've been involved with this reporting requirement historically, if you've been our contact, it's you're familiar with that those emails. We've sent them in the exact same format as we have for the last 5 years. So this morning, everyone was provided a data dictionary that our contacts were provided a data dictionary that defines all data fields provided in the full year and amended files, a sample full year text data file, a sample amended text data file, a guidance document for full year and amended data files, and a document that explains how to open a text data file in Microsoft Excel. This data was emailed to the individual we sent Form 1095 enrollment data to last year, or an updated contact provided by you specifically for 1095 data. And annually, we verify the distribution contact before we actually send the enrollment data files in January. We're in the middle of that process right now. So if you haven't replied to our emails over the last week asking you to confirm your information, please respond or reach out to us as soon as you can. I think at this point this morning, we have about 25 employers who haven't yet responded to our verification request. So if you're one of those, please let us know so we can get you those data files to the right email address. Now, text data files are virtually the same format as prior years. And so, there's a new carrier code for Premera Blue Cross Plan G. Other than that, all data values are the same as last year. There is one additional data field added to the end of each enrollment record. And this new 4-digit field is called the PEBB Program Indicator Code. Now, for everyone on the call today, this will have a value of PEBB for all employees, for all employee records. I know you can't read the full lines of data on this slide, and we'll look at that in a short bit, the actual format. But you can see the expanded view where the PEBB indicator appears at the end of the record. We added it to the end of the data so it doesn't change the data order compared to previous year's data. For those of you that are loading these into systems, it'll reduce the amount of edits that you'd have to create. Some of you on the call may be aware that we now administer coverage for all school districts in Washington, and that SEB value refers to school district coverage, but of course you won't see that on any of your files, but that's kind of the source of this new information. So let's talk about a couple things that are notable this year. And there really isn't that much. IRS extended one of the Form 1095 due dates for 2020. This is similar to prior year reporting deadline extensions. And so just as a reminder, here are this year's due dates. February 28th, 2021 is the due date for forms 1094B or C and 1095B or C that are paper filed with the IRS. So if you're a small employer, you may be, this may be the same kind of deadline you've worked against historically. If you're mailing hard copy paper forms to IRS, that's your deadline. March 2nd is the new due date for furnishing forms 1095B or C to employees and former employees. So these are the copies that we all receive as employees. That deadline is annually January 31st, but this year, as in past years, it was extended by our IRS under Notice 2020-76. And March 31st is the due date for forms 1094B or C and 1095B or C that are electronically filed with the IRS. So if you're a large employer filing more than 250 documents with IRS each year, you're required to file those electronically. And so just be careful. If you paper file forms, you know, then that 2/28 deadline happens before that March 2nd extension date. So don't get tripped up by that. You know, under that IRS Notice 2020-76, IRS indicated this year, this is new, that they may not automatically extend the due date in the future. And if that's important to you, you should provide IRS with feedback that you want the automatic extensions to continue. I know for the state of Washington, we'll be providing that feedback as well. And here's why. You know, remember this chart from a couple slides ago. It's a good idea to support the automatic extension because we know the majority of corrections to prior year data occurred during that historic automatic extension period of February. If IRS stops providing that automatic extension, you know, the regulations do still provide an option to, you know, uniquely request your own 30-day extension. And either method would help to reduce the number of corrected forms that you might otherwise need to produce due to those corrections that occur in February annually. And you know, if you were going to manually request an extension, just make sure you do so carefully and according to the regulations, because you know, the penalty for filing forms late is so great. It's you know, it's a $270 per offense penalty that can be discounted down to as little as $50, you know, for resolving that late filed form, you know, sooner than later. But those are penalties that they do assess. So if you are, that's why it's nice with the automatic extension. There's no messing around. You don't have to send a letter or wonder that IRS received it, or have that risk of a misstep. Also notable this year, you know, the 2020 Form 1095C includes some changes this year. There's a plan start month box that's been on the forms. It's mandatory this year, and so the PEBB plan year starts in January, so that value would be 01 for everybody. The Form 1095C is also 2 pages for all employees, regardless of whether there's, you know, 6 or more employees. And so that where I showed you on the other the 1095C, all those Part 3 reports for employee enrollments are all on their own separate page. There are also new individual coverage health reimbursement account provisions that really aren't applicable to PEBB reporting. We don't offer coverage that we don't offer ICHRA coverage. And so there's, you know, there's some information that was added to the forms that, you know, that it reflects that ICHRA coverage. There's a new age field. There are new line 14 codes, and 1094C form also has a new code related to ICHRA coverage. All of these things are not applicable. Let's just take a look at that 1095C. I think I kind of garbled my my description of that. It'll be a little easier to point to it. So on the 1095C, this plan start month box would be 01, because all PEBB plans start in the January. This employee age value is not needed because it only reflects to individual coverage HRA, and we don't offer those coverages, so this can be left blank. As I mentioned, that Part 3 got bumped over to its own form, so those are the changes on the 1095-C. Okay, and you know, this isn't really notable this year, but it has been notable every year. And this slide answers one of the questions we receive every single year from small employer groups. In the Form 1095-B instructions, there are specific instructions for how to fill out Form 1095-B that begin on page 6 of those instructions. And on page 7, there's a very important clarification that answers the question of what to report in Part 2. The tip is often overlooked, I think, because the first sentence starts with insurance companies, this piece here that says insurance companies. And people just move on to the next paragraph. But starting with the second sentence, the content is very meaningful for employers who are reporting self-insured coverage. And so that tip reads, starting with the second sentence, employers reporting self-insured group health plan coverage on Form 1095-B, except for an individual coverage HRA, which is not applicable to us, enter code B on line 8, but don't complete Part 2. If you entered code B for self-insured coverage, which is what you're doing, skip Part 2 and go to Part 3. And so that clarification makes it really straightforward to understanding how to fill out a Form 1095-B. On that form, bearing that tip in mind, you would know that Part 1 is just information about your employee that you might get from either our data file or your own payroll records. The tip covers this line 8. And so it indicated that for self-insured coverage, you'd enter a code of B in there. And then you would skip Part 2. And so people always wonder, well, is this supposed to be me, or is it supposed to be the insurance company, or what? It doesn't have to be anything because you skip Part 2. Part 3 is the issuer or other coverage provider. And in this case, you, the employer, are considered for self-insured coverage offered through a multiple employer plan like PEBB. You are the plan sponsor, and you would be included, your information would be included in Part 3 of that form. And then just like normal, your Part 4 information is the enrollment detail that can be, that you can get from our data files. So again, here's the list of documents that we sent to employers this morning. And I'd like to provide a bit of an orientation of these files. I'm really glad to have this opportunity because every year after we distribute the actual data files, we get a lot of questions from PERSPay staff who really didn't have a chance to read through the data dictionary to better understand those complicated text data files. So let's start with the data dictionary. Let me open that up here. Okay. And so this document's important because it describes the layout of the enrollment data files, and it defines each of the fields found in the actual data files. And as I mentioned before, only field 28 is different. Everything else is exactly the same as past years. This document also describes our naming convention. Each file is labeled with your agency code. It's the 3-digit agency code and what we call 3-digit sub-agency code. So the first 6 digits, like 900B39. And then the phrase employer group pay one data, e.g. pay one data, and then the year and month of the file. And so the first files will be 2021-01, and then .txt. As you'll see in the sample file when I pull it up, it's a pipe delimited text file. And a pipe just refers to the character on your keyboard that's right above your enter key. It's a straight line up and down. We use that to delineate the fields of data in the text file. And the fields are padded with spaces, and so it's an equal size for every record, even though the data within the file might be different. Like an address, my address and your address don't have the same number of characters, but they're padded so that they represent the same fixed width size. Let's take a look at the fields. Now, some people see this, it's just a list, right? Well, if you go down to the next page, it's actually a dictionary that describes the list. And so field 1 is the subscriber SSN. It's just the SSN of the employee or your former employee, if it's reporting retiree coverage or COBRA coverage or leave without pay coverage. All members enrolled under the subscriber, like a spouse or a child, will have that same subscriber SSN in field 1. So that's a way you can tell all the individuals that are enrolled under that subscriber. Field 2 is the member SSN, so that's the unique SSN for the subscriber or the spouse or the dependent to which the record relates. Field 3 is the for coverage year and month, and so that is the month for which the record describes. In January of 2021, we'll provide you with up to 12 records per enrollee. And so you might get a for January 2020 record and a for February 2020 record and a March for 2020 record. You might get 12 different records for each month and year in 2020. Field 4 is the agency sub-agency code, so that'll also match the agency sub-agency on your file name. It should be only the agency sub-agency number that you recognize. Field 5 is a member type, which simply indicates whether or not it's a record for an employee, a spouse, or a dependent, 1, 2, or 3. Fields 6 through 10 are simply member identifying information. Now, field 10 might be particularly important for some of you. If you don't have the member's actual SSN, then for Form 1095C reporting in Part 3 or Part 4 of the Part 3 of 1095C or Part 4 of 1095B, you may be asked to use a member's birth date. So that information is included there. For dependents, you may not have that anywhere else but our file. Field 11 is an enrollment indicator. It simply indicates if the record defines that the member was enrolled or waived, or for corrected records, whether they were not enrolled. One of those 3 values. Field 12 takes up about 3 or 4 pages of our dictionary. Every year we update this information. And so for 2020, you'll see it's a lot larger than it was in 2019. So here's what it was last year, the year you're most recently familiar with. For 2020 enrollment, we've added SEB coverage. Employer groups can simply ignore this because you won't find any of these values in your data files. You don't offer SEB coverage. Here are the PEBB coverage health carrier codes. And so it simply describes the 4-digit code that relates to the type of coverage that the member was enrolled in. One important note, for each of these years, we list here that all UMP carrier codes that begin with U, and this year V for SEB, are self-insured coverage. So for PEBB, it's all of these coverages that begin with U. These are all self-insured, and those are the coverages that need to be reported in Part 4 of the 1095B or Part 3 of the 1095C. Let's zip past all the historic year data. Okay, field 13 is an eligibility type, and so that simply indicates whether it's employee, COBRA, leave without pay, or retiree coverage. Field 14 is we call this a coverage offer indicator, and for those of you that are completing Form 1095C, you might align this code with your line 14 requirement to provide, to let IRS know if there was an offer of coverage. So we simply say if the field 11 was Y or D, we say, yes, there was an offer of medical coverage. Whether they chose to waive or enroll doesn't matter to that line 14 offer of coverage value on the 1095-C. Field 15 is a medical effective date. This really isn't needed for Form 1095 reporting, but it reflects the effective date of medical coverage based on the current eligibility type. So if I changed a health plan mid-year for a special open enrollment, this medical effective date would change to the new date. If I've been enrolled in the same employee coverage for the last 5 years, it would be a 5-year-ago date. Field 16 through 20 are address values for the subscriber's street address. And field 21 is an originating SSN value. And there are kind of 3 scenarios represented. The first is, in some cases, the employee, him or herself, will simply have an originating SSN that equals the subscriber SSN. That's kind of unremarkable. But these 2 scenarios, if there's a surviving spouse enrolled within the year of the subscriber's death, this is used to link the surviving spouse to the deceased subscriber. So the question we always receive is, hey, I don't recognize this person. Let's just say Jane Smith. And but you may know John Jones, and John Jones and Jane Smith may have been married. And Jane Smith is the surviving spouse of John Jones. And so John Jones's SSN may be listed under the originating SSN value. And so when you can't find Jane Smith, if you query your payroll information for the originating SSN for John, you may recognize a former employee who unfortunately is now deceased. You know, when that happens, we establish the surviving spouse with their own coverage so they don't keep getting communications to their deceased spouse. So that's one way to know that that person is linked to your former employee. The second scenario is a COBRA subscriber who's enrolled within the year of separation from the original subscriber's account. And so again, you under COBRA, you know, a subscriber and a member have their own independent election rights. And so you may have an employee who terminates and has a COBRA opportunity, and they choose to only enroll a dependent, maybe a child. That dependent child will list, you know, you get a record with the dependent child's information as the subscriber SSN. The originating SSN would reflect the former employee who you might recognize better than their enrolled dependent child. And so it'll make sense why they're connected to your file. Field 22 is simply a Medicare value. If that is flagged, then it means that we have validated that the you know, oftentimes retiree did show us their Medicare A and B cards. So we've validated that they are enrolled in Medicare. Again, this is not necessarily so related to anything you have to report on the 1095 itself, but it does tell you if they're enrolled in Medicare, and that's important for some employers who are reading a potential impact on their need to report 1095 on a Medicare enrolled person. I can tell you for the state of Washington, regardless of whether a retiree is enrolled in Medicare, we do produce a 1095 for all of them, even though they're enrolled in Medicare and Medicare is minimum essential coverage. Field 23 is simply a split account indicator. It lets you know that you have an individual who is enrolled in uniform medical plan where the subscriber is not. So you may have a subscriber who's enrolled in a Medicare Blue Cross Medicare Supplement Plan F or Plan G, but you may have another family member who's not eligible for that plan. In that case, PEBB rules allow them to be enrolled in uniform medical plan. And so you would have only a dependent enrolled in UMP and the subscriber enrolled in Primera. In that case, you would only have to report the enrollment of the UMP enrollee because that's the only coverage that's self-insured. Field 24 is simply the month in which we're reporting the data. So it always reflects the current date, even if it's reporting retroactive detail for a prior period. 25 is a country, 26 is a subscriber ID. That's just an internal, our internal ID number for our software that manages the enrollment. 27 is a record status code. It's either an A or D, meaning it's an active record that needs to be reported, or D, it means a record that needs to be deleted that was previously reported, when a correction occurs. And then finally, that PEBB program indicator. So let's jump into what an actual file looks like here, and it may make a little better sense to you. I realize this is small. So when you get this file, you'll see it's just, like I say, it's the fixed width flat file format. Let's make it a little bigger so we can see. These are pipes. These up and down keys are the pipes. That's the key on your keyboard just above the enter key. When we open this in Excel, those are the characters that we can key off of to make this split into different columns. But you'll see here, this represents subscriber SSN, member SSN. This is the 4-period month that I described. So you can see for John Q. Public, we've provided 12 different records from 2020, 2020-01 January, all the way through 2020-12, which is December. This is the enrollment indicator I talked about. Yes indicates that yes, they were enrolled in coverage. This is the health carrier code. So you can see John was enrolled in uniform medical plan. That means you have to report on that. Down here you see it's CV. That's a Kaiser plan. And so Jane Doe, these months don't need to be reported. They're on the form in Form 1095B Part 4 or Form 1095C Part 3. They're not uniform medical plan. They're not self-insured coverage. They don't need to be reported. This indicates the type, eligibility type. So you see John was an employee for 2 months and then a retiree for the remaining part of the year. And way over here, you see that these are A records, and so they are active records that need to be reported. When we send you a amended file, it will be in exactly the same format. So this is the sample amended file that we've sent all of you. You can see the structure is exactly the same. They'll always be much smaller because they're only reflecting changes to the information that we previously provided. And so let's talk about how you know how to use these amended files. We give you a document that's called PEBB Highlighted Instructions for Sample Amended Employer Group Files. And basically what you'll see here is this top section is simply a view of the full year sample files that we gave you. And these bottom records are the corrected files, the amended records that we've given you. And this middle section describes, let's go a little farther so you can go in, read it. This center section describes how to use the amended records that we provide you. And basically, we're talking about 3 different scenarios. A record was not previously provided, so we're giving you a record to add. A record that was previously provided should now be deleted, so we're giving you a record to delete. Or changes occurred to a record that was previously provided, and so we're giving you records to describe that change. And so when you look down here, each of these color-coded examples of adding, deleting, or changing records, and for changing, we give an example of changing a health carrier code and changing an SSN, are color coded, including the A, D, or the A or D, the add or delete, the active or delete codes, that are color coded to show you how they interact with the previous records that were provided in the annual file. Hang on a sec, I need to move something so I can get to my scroll. So, for example, when we add a new record, you can see that we're providing a 2020-09 4-period value, and it's an A record. So you know that this is a new record that wasn't previously provided. Up above, you can see the other green-coded records. John B. Doe was only enrolled in October, November, and December based on the original data we gave you. But the correction indicates that he should also have been enrolled in 2020-09. When you put those two together, then you come away with a complete picture of John's enrollment of September through December. And it works the same way for deleting, changing, or doing SSN corrections. Each of those colors are reflected, and so you can see how the corrected record interacts with the record that was originally provided. Okay. Finally, I wanted to run through simply opening a text file in Microsoft Excel. A lot of people want to know how to do that because because it makes it a little easier to deal with some of this data. And so if you simply open if you open Excel and then locate the file that we've provided you, and so in my case, I need to go. So I'm just navigating to the location of the file. Now I know this folder is the file location where I have that file, but nothing is displayed. So the first thing you need to do is tell Excel that you want to look at all files because it's not originally displaying Excel type files. And then locate the data file that you're trying to open. So in our case, I'm going to open that sample full year employer group file. And then I simply say open, and it'll take me into a little utility, a 3-step utility, where I say this is a delimited file, and then I move to the next field, or the next step. I turn off that it's not a tab delimited file, and I add that pipe that I mentioned was above the key above the enter key. Once I enter pipe, I hit next and go to step 3. And in step 3, I'm going to select all of this information. So I'm just going to scroll over here. I'm going to hold my shift key and click, and now I've selected all of that information, and I'm going to indicate that it's text information, and then simply click finish. And what I've now done is I've opened up that flat data file in Excel. Now we don't provide headers, so if you wanted to provide your own headings just for your convenience, you could insert a line and subscriber SSN. You can add your own headings per the data dictionary. But in this way, you'll be able to do commands like filtering that you might be familiar with. For example, let's make this a little easier to see here. If I wanted to know what records were tied to Jane Doe, for instance, I could filter this data to only be looking at Jane's SSN, which will give me all family members under Jane. So I can quickly see Jane and all related family member data. So a lot of you prefer to use Excel. It's just that easy to open it. The document we provided this morning will describe exactly how to open those files in Excel. It goes through the exact same steps I just walked you through. And after you do that, I guess the big thing to remember is when you save that file, make sure that you're changing it to an Excel formatted file. Otherwise, you will be modifying that text file and you will not like the results. So make sure you're changing it to Excel file, then you can save it right there in your same location and open it as an Excel file in the future. All right, so that kind of brings me to the end of the prepared information. I realize we're getting kind of short on time, Tila, were there any questions that came up that would be applicable for everyone? If we don't get to your question, of course, we'll follow up with you by phone or email, or if you send them through Fuse, we'll respond by Fuse.
Yes, James. There was a question in regards to, I know PEBB provides enrollment information for retirees and COBRA, but we don't report them as they are not full-time employees. Do I need to report them?
So only if you have employees who are not full-time, and this is only applicable if you're a large employer. And so if you're a large employer, you're reporting those employees because you're not reporting those employees in Part 2 of Form 1095-C because they're not full-time employees. But you do need to report their enrollment information if they're enrolled in uniform medical plan coverage. And so Form 1095-C instructions do provide a code that you can use, a code set that you can use for lines 14, 15, and 16 in Part 2 of the Form 1095-C that indicate that they were not a full-time employee for all 12 months of the year. And then you can also report their enrollment as required down in Part 3 of the 1095-C because they're enrolled in self-insured coverage. I think there is, and the majority of employers will do it in that manner, so they don't have to do Forms 1095-B. But I believe the instructions do provide an option for also using 1095-B for those not full-time employees. But it requires you to kind of work two different forms, and there's no real reason to. The instructions do provide for how to report employee who's not full-time for all 12 months. That's the one you're looking for.
Okay, so I have another question in regards to how to fill out the form. It says, if my employee is enrolled in a plan that is not a self-insured coverage, then I will need to fill out Part 2. I believe this person is referring to 1095-B.
So what we clarified on the 1095-B, whoever this is, why don't you contact us after, and so we can make sure. But let me just talk specifically. The clarification in the instruction is that, for 1095-B, the only thing you're reporting is self-insured coverage. That's the only requirement for you small employers, is to report self-insured coverage. And so you're always filling the 1095-B out. In Part 2, you're skipping Part 2 because you're providing self-insured coverage. Under Part 1, you're putting that code of B in and I'm talking specifically for PEBB coverage. If there's somehow you're offering other coverage, this is not the advice for that. But the only thing you're reporting is self-insured coverage. So you always put a B in the box in line in Part 1. That tells you to skip Part 2, and then you're reflecting the enrollment only of people who have a U code in that health carrier code. Any of the 4-digit health carrier codes that begins with the letter U. Anyone else in your file who doesn't have a U, you don't have a reporting requirement for them.
Okay, the last one is again about self-insured. Do employer groups also need to report uniform plans as self-insured, even though we aren't self-insuring the plan?
Yes, and so our organization is administering the benefits on behalf of multiple employers, and so we're organized as a multiple employer organization, right? All of us. And IRS indicates that for a plan maintained by more than one employer, the plan sponsor is each participating employer. And so that reporting requirement flows down to each participating employer. That's why we are giving you data and not doing a report ourselves. Now, it's different for the other plans, the non-uniform medical plans. If you have 3 employees and 2 of them are enrolled in uniform medical plan, you have a reporting requirement for them. If the 3rd employer elected to enroll in Kaiser Permanente coverage, Kaiser Permanente is a fully insured plan. And those plans that are organized as a fully insured plan are responsible for completing a 1095B themselves. And so your third employee will receive a 1095B directly from Kaiser, where the first two will receive a form directly from you as the plan sponsor. This stuff is kind of complicated based on your standing and then the unique reporting requirements. So we're always willing to help walk you through the requirements by directing you to the guidance that's provided by IRS. So we don't see our role as one of directing you on how to do these things, but we're really good at directing you to the clarifying information in the IRS documents, so you can best make your own decisions. And I see we're getting at time now. Tila, was there anything else that we want to cover?
Nope, that's it. Thank you.
Okay, so as always, you're welcome to contact us, and we'll be as helpful as we can. And typically, I think callers, go away satisfied with that interaction. So I'd encourage you to give us a call, especially if you're new and some of this stuff is a little more confusing. Feel free to give us a call if you have questions. And then let me get back to this. I think there's another slide here. Jamie, I think this one's yours.
Thank you, James. And thank you both, James and Tila, for that wonderful presentation. I'm sure everybody gleaned a lot of information from it. It was pretty interesting. So just so you all know, I did mention at the beginning of this webinar that the webinar is being recorded, as several of our past webinars. So they're going to be recorded and posted to the notices and updates section of the PERS Pay website. So if you're looking for anything we've done in the past year or so, you can find it out here in this section as well. So head out to PERS Pay. On the right-hand side, there's a green and black button. Click on that and go down to the recorded webinars section. Also, for those of you who registered in advance, I did send out a copy of those slides, so hopefully everybody received those. And of course, if you are interested in attending any future webinars, you can check out our training section of the PERS Pay website as well. So we always list our upcoming trainings out there, and you can register once they show up. Okay, so for the next one, I believe it's just a thank you slide.
Yeah, sorry.
Oh, it's okay. Yeah, so that's it for us.
You got me.
That's okay. Thanks, James. All right, everyone. Thank you all so much for attending. And thank you again, James and Tila, for doing such a wonderful job.
Thanks, everybody.
Bye, everyone.